Hi, friends. I am back with more cycle talk. Um, I was actually having coffee with a friend today, and we were talking about cycle tracking and even just like our cycle history. Um, and I had been thinking over the last few days how helpful it could be to kind of give my background, my cycle history as like a bigger picture here, because honestly, like the way that we start cycling has everything to do with how we continue to cycle. And bless my daughter's heart, because one day, when maybe not in a negative way, like bless her heart, but like there are just going to be things that she knows and things that she gets to support her cycle with because of all the things that I know. And even like genetically speaking, things that we are predisposed to as females in our family. Anyway, I'm rambling, but cycle history plays a huge role in how you cycle as an adult. And so, um, I'm going to take it all the way back to, I actually remember the day, which is kind of funny because the day I started my first period happened to be take your child to work day. And I actually wasn't with my mom at the time at her work. I had gone with a friend's mom to the pharmacy where she works. And so, anyway, I was 11 years old and 8 months. I actually did the math earlier this week because I was trying to think about it, like when in the year it fell. But um, yeah, 11 going on 12. And honestly, that's not like too young, but it was still, yeah, on the younger side of um, like when puberty started for me. So uh, I do remember like the first period being okay, but it wasn't too long after that so that was like the end of April, April 25th, which always sticks in my mind because of Miss Congeniality, like what's the best date? And anyway, not relevant. Come summertime, I think I had my next period, like the second one that I had. So it would have been like in June. I went to church camp and it was so horrible. Like I am scarred by that. I remember it happening. But it was so heavy and so many clots. Like I remember getting out of the church van. This is just awful. But I remember getting out of the church van, and as I took steps, I could literally feel clots um, coming out. And for a not even 12-year-old to experience something like that, but then also to feel like the shame of not being able to talk to someone about it, or just like how intense PMS symptoms were so early on for me. I can remember like being nauseous and like literally feeling ill. And my mom would tell me, like, yeah, it would just take me out. Like, I wouldn't be able to go to school, or I'd feel so sick that I would throw up. Um, and I just, like, that is the beginning of feeling like this is normal. Like, this is just our lot in life as women, and I guess I'll deal. And there was so much shame so early on because I did feel like I was younger. I was one of the first of my friends to get my period, and you just don't really know what to do about it. So, as I continued to cycle throughout those adolescent years, through middle school and into high school, like it was really irregular. Like, I didn't have a period as frequently as I should have, which was congruent with how I cycled even in my early adult years. I remember in high school going so long without a period. I talked to my mom about it and just kind of feeling concerned. I didn't really know what that meant. And so she took me to the gynecologist and he took me into his office, which even that is just kind of weird. I don't know why we left the patient room and we went into his office to discuss this. But I remember sitting in his office and him discussing starting birth control. And at the time I was just like, I just don't want to be on birth control. I don't want to have to do that. And he was explaining to me that it would help me start cycling again. I was less than 16 years old when this happened. And that just is an issue. It's an issue for women everywhere that this actually happens so frequently, for a number of reasons, whether that's heavy bleeding or a missing period or just cycle symptoms, acne. The list goes on, that we go to our doctor and at astronomically young ages are recommended hormonal birth control. And there are so many risks associated with that long term. And there's just a lack of informed consent happening. And I believe that and I stand by that, because I didn't have informed consent. And I know there are so many people who that's their story. So I did take it for a little while. I was also running cross country and probably not eating enough. Again, why my period was probably missing. And so I actually got injured and stopped running, and my period became regular again. And I came off birth control because I hated it so much. Um, and just still like would have debilitating cramps and just things that I was like, yeah, this is it. This is how I'm going to spend my life cycling, which when you think about it in the grand scheme of things, if I started at 11 years old, almost 12, and I'm going to cycle well into my 40s, that's a long time to deal with really crappy symptoms that literally interrupt your life month to month, hopefully. Um, which is why I'm really passionate about teaching these things and informing the next generation too. It's not just women who have been trying to get pregnant, because obviously pregnancy is a wonderful thing that comes out of being able to menstruate, but it's not the goal for everyone. And our quality of life happens every day, day in and day out, way more often than we're trying to get pregnant or are staying pregnant, having kids. Those years are so few in comparison to the grand scheme of cycling over a woman's life. And so, anyway, there was a lot going on. Like, I still am sensitive to estrogen, and estrogen is the reason why all of those things were happening over my adolescent years too. Um, I think of things like endocrine disruptors that were present, Bath and Body Works, the glitter rub, the lotions, the all things scented, and lots and lots of packaged foods, just so many things that mimic estrogen production, which my body has no problem producing, and honestly holds on to it a little too much. Um, and so, anyway, it was a long time in the making, my cycle issues, and they still exist, and I still am working to support them. Um, Way less work now than they were a few years ago, but I have the power to change them, and I know, because of what I know about my body and what I've learned, body intelligence, um, I don't have to rely on a doctor, although doctors are helpful at times, to be able to support my body where it's at. And so we all have a cycle history. Your cycle history is something that's really important, and I talk about it with my clients. But it tells a whole story, not just showing up here in the last 6 months, but what has that looked like over a lifetime.